So, I don't know how I go behind Mario and some of the other great presentations, but everybody's presentation was great. And so I have, of course, big shoes to fill. But I'll try my best, and I'm sure I will be judged accordingly. So, one of the things I like to do is I like to tell a story around the presentation. So hopefully a little bit of my storytelling process about how I got through this process, through all of the experience, you will be able to get a kind of unique picture of what my experience looked like. I would be crazy if I didn't just thank the BAI staff for their patience. I know it got kind of hella crazy with me just not turning in things on time. Let me just keep it real. You know, my role at AFC has kind of expanded, and personally things went very well this year. I got to take a vacation that I haven't been able to do in a few years. I got to take on Black Pride. My role increased in Step Up, Get Tested. So a lot of great things were happening while this big, enormous, great thing was happening, and there just were competing things that were going on. But I'm just so grateful that I got through the program, and I think I learned a lot. And because of this experience, it made it all that easy to be able to be a good asset to my community back in Chicago. So the state of AIDS in Black Chicago. So I started off this journey with Brandon. And I'm ending it with Brandon, but in a different capacity. So back in Chicago, when we first started this, and Brandon and I first initially did our demographic profile, approximately 3.5 million people, total of 8 million people, 9 million people, I'm sorry, that live in the Chicago proper. About 25,000 people in the city of Chicago are living with HIV. 20% of those folks are HIV positive. We know through our chat study, that's the Chicago HIV/AIDS, don't kill me. The chat study, I'll just keep it at that. We know that Black men who have sex with men is the only group that is rising in HIV rates versus being stagnant or declining. We know that about 37% of African Americans are living in the city of Chicago, but make up more than half of new HIV cases annually. That's a lot, right? So Black MSM between the ages of 18 to 24 are the only group that continue to rise. So actually we can break down Black MSM even further. So our HIV prevention needs. So, you know, Brandon and I did during our 3-day training, we did a Black Lives Matter community forum. And so at the time, we didn't kind of think of it as a kind of a community needs assessment. I don't think we thought of it as that, but certainly it was that. So we invited folks, we invited 2 men that do a lot of work across the country around Black Lives Matter, around issues that are important to Black communities. That was Keith Boykin. How many folks have heard of Keith Boykin? Okay. Most folks. Keith Boykin is a political strategist, is a social commentarian, I just made that word up, I think, around issues that impact HIV. And he's also kind of a celebrity, if you will, an author, all those type of things. He's on political talk shows like MSNBC, CNBC. Great asset to our community. I love Keith Boykin. And he happens to be from my hometown of St. Louis. So we invited him to come. Darnell Moore. How many of you all have heard of Darnell Moore? So Darnell Moore is less known, but he is a rising activist. He's out of New York City. He came and did some other things. Precious Davis, trans activist in Chicago, and really is kind of expanding her reach across the nation. And other Chicago activists came together, and we had a kind of a fussing match, if you will, around what are some of the things that are missing in Chicago. And so I was able to take some of that data, or some of that information, and utilize that. So kind of our community forum focus group, if you will. So we thought about funding approaches with holistic approach. utilizing holistic approaches. So what the hell does that mean? So when we look at HIV funding, we know that HIV funding around what we do is very linear. Meaning that it's just about HIV, it's just about MSN. I think Lori talked about it earlier, doesn't give room to service other populations. So one of the things that we're looking at now is really looking at those funding sources. They allow us to look at the full need of the Black person. So one of the things they're talking about is missing spaces in communities of color. So I'll get to a little bit about that a little later, but those were some of the things that were identified both within the focus group I was able to do and the community forum. Oh, an expansion of accepted primary prevention service activities and interventions. We're all on this PrEP thing right now. PrEP, wonderful. But one of the things that some of my colleagues talk about is there's still a need for evidence-based interventions. We cannot throw the baby out with the bathwater. We need to have a full, that was a pretty bad analogy, wasn't it? We really need to use a comprehensive approach as we talk about HIV prevention, as we talk about treatment, as we talk about care. So the gap analysis. So lack of education and access around PrEP. So as Brady talked about in his presentation, he talked about a lot of Black folks aren't, you know, he had, I think it was 1,000 people, PrEP patients you all had at your clinic. Probably around 100 of those, about 10% of those are Black people. We're talking about New York City now. So if we think about those disparities that are happening in New York, think of the big huge disparities that we have in places like LA and of course Chicago. And Chicago is a Black political mecca in this country. It produces large-scale Black politicians. Why isn't we, President Barack Obama, I had to do that, President Barack Obama. So, you know, we have these people here, we have the political muscle. Why isn't it that we are always behind in this newer education? Lack of holistic approaches. That's going to keep coming up. So in Chicago, for instance, we have an LGBT center, right? That's situated on the north side of the city. The north side of the city is made up of mostly white folk, okay? When you look at the west and when you look at the south side of the city, there are missing kind of gaps that are happening from food deserts to community centers to holistic health centers. So one of the things that we continue to hear and give rise when we're doing these focus groups and kind of some of these things, we're finding that people are having to go way across the city to get services that they need. And that's one of the gaps that we're seeing. Lack of housing for youth. Yeah, a lot of folks don't think about this. Well, maybe folks do. But when we talk about elder health, housing is a part of that, right? When we have conversations about youth, we talk about violence, we talk about education, maybe we talk about reproductive health, but we're not talking about housing enough. And not that we're probably not talking about housing, but there are no housing services in Chicago for youth essentially. Well, that's not true. There's limited housing resources for youth. And so those are one of the things that we found in our analysis. And that just did not come out of just talking. We also used our, the city of Chicago just finished our priority setting experience. Do we know about community planning? Does everybody in the room know about community planning? Okay, so community planning is a process in which the community comes together, comes up with gap analysis, do resource inventory and things of that nature to find out what is needed in making sure that we're funding, we're giving priority to funding issues that need to be dealt with. That's the easiest way I can think of talking about it. So that's that. So in closing of that, we talked about our gap analysis, we talked about our community demographic profile, we talked about some of those things that kind of get us to what we're going to talk about next, which is the Black Treatments Advocates Network. I'm not sure if I'm going to be able to give any more than what my other colleagues have done, but I'm going to try. So the Black Treatments Advocates Network, The mission is, well, let me go back. So let me talk about BTAN. Well, no, I'll do what I was doing. The mission of the Black Treatment Advocates Network is to increase patient access to and utilization of treatment and care, strengthen local leadership, and advocate for policy change in Black communities. So 4 project areas. We see the project areas being, they ain't working. Treatment education, patient navigation, advocacy, and disclosure. So, what is going on? Did I mess up? This would happen on here.
On your way back, would you grab that jacket?
Shade. So, oh, it's not moving here.
It did.
Oh, it did. Oh. Okay. So let's talk about, before we talk about the successes of BTAN Chicago, let's talk about BTAN Chicago in the grand scheme of BTAN. So, you know, we've often talked about the dramas of Chicago. Chicago, my city, I love her dearly, but we are a dramatic bunch, right? So, and you know, we may laugh at that, but it really does allow different kinds of people to be a part of the process, and it becomes such a fantastic through that kind of difficult, rough process comes a lot of great ideas. So right now, BTAN Chicago is undergoing a makeover. And so President Phil Wilson of BAI has come to Chicago monthly for at least the past 5 months, I would say, to try to rehab BTAN. And I can tell you it's successful. So one of the things that I had talked about in my last presentations were that there were similar kind of organizations that had been around for years that were that kind of did some of the same things as BTAN Chicago, but they didn't have the infrastructure. That was the West Side HIV/AIDS Regional Planning Group and the South Side HIV/AIDS Regional Planning Group also. And so one of my ideas was to have those chapters take on kind of the BTAN model and kind of have a mother model that kind of oversees it. Right now, we're kind of vetting that right now, and I'm very excited that people are coming to the meetings and being engaged and really trying to find a common ground in making sure that we have a BTAN Chicago that works. So I'm very excited about that. So we have people that are coming to the meetings monthly. We have everything from the women from the Holy Angels Catholic Church to Southside Health Center, who was originally a part of the original BTAN model, to some of the past leadership of BTAN Chicago. So it's really coming together quite well. I saw Louis Braggins, who is also a former AHU fellow, who actually has come back. Phil Wilson, you know, his touch has really kind of made it golden, right? And so, of course, I'm representing Step Up, Get Tested in the AIDS Foundation of Chicago, and right now very kind of unclear as to what my role will be, or if I'm going to play a role. I'm sure I will play a role, but how that will look, just because we're undergoing this new kind of cosmetic surgery, and we're going to look gorgeous. We're going to look like a Beverly Hills housewife when we're done. More like a Compton housewife. We'll say that. Okay, so some of the Chicago BTAN successes. So I have to say, not 2 fellows have successfully attended. I can now say 3.5. So I'm going to count Brandon as a half because he was part of us for half the time, right? So 4 fellows have successfully attended. I think. We'll see after I get done with this presentation. We did 1 3-day training. Actually did 2 3-day trainings over the past couple years. We have 5 collaborative HIV groups that are around the table, including some partner agencies like the AIDS Foundation of Chicago. I'm not saying that because I work there, but AFC is the leader in HIV care, prevention, advocacy in the Midwest. It just is, you know. We just are. Holla. Nearly 50 organizations service the community of HIV services in Chicago. Chicago does not have any lacking of people that want to do HIV work. It's just how it's organized, how funding is allocated. And we, model city for conferences. I don't know what that means.
Transportation, downtown, conference location, centralized.
Well, this is Chicago BTAN 6. I don't know why I wrote that. Maybe I was having a seance issue from Mayor Washington. Okay, purpose. So the purpose, the purpose of BTAN Chicago is to increase the science and treatment knowledge, increase community knowledge around PrEP, decrease stigma and raise HIV awareness, recruit new members for BTAN, and serve as a community networking opportunity. So I'm pulling this from kind of the past. So this is kind of old, but because for the purposes of this symposium, I decided just to pull from that. This is still being developed, but I'm pretty sure that most, if not all of these are going to be, I don't think the purpose of BTAN of Chicago is going to change that much. Maybe, I don't know. BTAN project areas, we know this already. We've kind of talked about it. Here's the BTAN logic model. Not going to spend too much time on that. Obviously, we've gone through that 5 times. So advancing BTAN. So BTAN Chicago launched in 2011. It was part of that, or 2010, 11. It was part of the original launch. When BTAN Chicago first started, it had members galore. I remember going to a BTAN Chicago event on a rooftop, and it was absolutely so beautiful. Phil Wilson was there. I think Rania was there. I don't know if you were there, but it was just such a phenomenal piece, and it was so community. And I think that's why, and maybe Rebecca can speak on this, is that's why BAI, although Chicago is not necessarily a top city for BTAN originally, but I think that's why there's so much resources being poured into Chicago, because I think BAI and others have seen what BTAN Chicago could look like. So although we've had a tough kind of couple years, I think people know that. The original convener was Southside Health Center, so they were our original host agency locally, and the founding co-chairs was Louis Spraggins and Yah Simpson. Okay? So developing partnerships. So I talked about this a little bit. So Gilead Sciences, also I did not really talk about that, but these are some of the relationships that have been developed. Of course, I didn't put the AIDS Foundation of Chicago on there, but the AIDS Foundation of Chicago is a huge supporter. We pay for a lot of things for BTAN Chicago. We are making sure that it happens. Also, Chicago House, Brandon's former agency, with the movement of Anthony Gutierrez, we have seen that happen. We are also seeing former folks. We're also seeing that through the partnership with Step Up Get Tested with the 3-day trainings and 1-day training. People are starting to kind of lift that up, and I see Brandon shaking his head yes, because he was certainly a part of that. The role of all the groups are developing right now and are kind of serving as this big think tank around what can BTAN Chicago look like. So BTAN trainings, let's talk about that. Brandon had all of the images. I'm not going to give you any images, but I'm going to tell you a story about the BTAN trainings in Chicago. BTAN Chicago, the 1-day training, was absolutely phenomenal. I walked into the room, and me and Brandon did ours separately. So I'm going to talk about my experience. We walked into a room of people that were so excited to have this education. When I first started talking to people about science and treatment and my ambition around bringing science and treatment based on my experience at AHU. I had nurses, and Brandon can attest to this, I had nurses say to me and doctors say to me, people don't need to know that information. People don't need to know all that. You're going to just mess up people. And so my attitude about that was, and I used to be one of those kind of people that wanted to limit information because I just assumed that people were too stupid to know. That's basically what it comes down to. Or you know, people are not smart enough to get it. And so people put me in that category. And I kind of got it, I think, you know, by being through this program over the past year. I kind of got it. Do I got it 100%? Not necessarily, but I got something. And so we were able in 4 hours to give that same kind of experience to other people that we once had. And so in that training, I was able to talk about the HIV life cycle and the origins of HIV, and I had the woman from IV come in and talk about the hepatitis C life cycle. So we didn't learn about the hepatitis C life cycle, but she came in, she bought lunch, and people were just totally happy. How we were able to recruit people. As you know, like I said, AIDS Foundation has a huge network. We pushed it out on our network, and we got 20 people to sign up for the training, and about 15 people that actually showed up, which was fine because, you know, me only doing one training, you know, that's kind of a lot of people for one trainer, right? So we also had Alan Johnson show up, who was a former AHU, well not former, he's an AHU fellow that went through the program last year to kind of do some fact checking behind me, because at that point I was pretty new in my process in October. So this took place on October 19th, and we had such a wonderful time, and people kept asking, can we do more? And I'm like, sure. I didn't know y'all were gonna like it that much. So it was such a wonderful thing. So our pretest median score was around 59 to 62%. When people left, they were at 84%. Evaluation survey results, 91% of the people were extremely satisfied. I have to tell you, I got a couple low scores because there were points in the presentation where I got pretty, hi guys, come on in. I pretty much got a little turned around in my presentation. Again, it was about learning, right? And people scored me accordingly. And I was totally not used to that because I'm like, I'm pretty much a good trainer. And so for me, learning the new skill was kind of developing. I didn't get the 100% that you got, Mario. And so that was wonderful. So let's talk about our 3-day training. So, you know, Brandon and I got together right before the Thanksgiving holiday, I think it was. We were a week before the Thanksgiving holiday. And we had, at this point, been dragging our feet. And not dragging our feet because we didn't want to do it. We had World AIDS Day also on the horizon. We had all of these other activities going on. It seems like anytime this is due, there's a big kahuna also due. And so we finally got with Anthony sometime in December, who was our contact at the time. And we put together a pretty, I think, aggressive agenda where we flew people in from across the country. I had some funding that I got from the Illinois Department of Public Health to do some capacity building. I think we spent probably around $10,000 on the conference. We made sure that it was in Chicago. Chicago can be very territorial. So we had it in a neutral spot, and most times neutrality means having it in the loop, where everybody can get to the place. If you have it on the north side, south siders won't show up. If you have it on the west, so we wanted to make sure that everybody felt invited. We went through the topics with Brandon's presentation, but we covered everything from the HIV life cycle to the pathogenesis of HIV, back over to the origins of HIV, back over to PrEP, back over to treatment as prevention. They got it. Approximately 57 people attended the 3-day training. 35 people were eligible to get their certificate. Our requirement was that in order for you to receive a certificate, that you attend all 3 days, all day. We had 35 people to do that. Maybe about 36. Let me start with the challenges, because I like to end it. It's fabulous. Some of the challenges were that was the coldest week in Chicago's history. And I'm not lying to you. I take that back. It was negative 20 degrees on the last day of the training, if that tells you anything. And people still showed up because it was that damn good. I have to give it to Dr. K. I have to give it to Christina Hill, our president, John Peller, Ya Simpson, former co-chair. We had a few other people that showed up. And it was such an incredible 3-day training. And people were like, are y'all going to do this again next year? And will you all bring it downstate? And so many people wanted us to bring this down, as I like to call, down in the Delta. Still in a little bit from Mississippi. Okay? The flyer was also phenomenal. We had a program book similar to BTAN LA's 3-day conference, and it was fabulous. Okay? And I gave you all those. I gave you our programs at the last one, and I would love to email you one so you can have one. So, my problem statement. In the city of Chicago, there is a lack of science and treatment literacy among community members and service providers. This creates barriers to accessing and adhering to HIV treatment. As a result, HIV rates continue to increase among young Black MSM and Black women. And so, so one of the things that we looked at was, prior to me coming to this training, my supervisor got promoted to vice president. And one of the things in her promotion was that AFC built a capacity building and technical assistance program. And so science and treatment literacy, as we were moving through this process, one of our cities, one of the BAI, Black AIDS Institute, went to, I think, 10 or 12 cities around National Black HIV/AIDS Awareness Day and did a workforce survey. They did the workforce survey prior to National Black HIV/AIDS Day and kind of unveiled the results to our city. And I kind of helped coordinate it. And light bulb went on. Light bulb. Light bulb went off. And I talked to Cynthia. And I'm like, we could be on to something here. Our 3-day training is coming up. And science and literacy is pretty poor among our workforce here in Chicago. I think Chicago and Illinois kind of ranked, I think it ranked a D. Oh no, an F. It was an F or a D. Some people took offense to it. But I'm like, the truth is the truth. You can't hide away from the truth. If that's how you score it, that's how you score it. The scores are the scores. So we looked at that not as a condemnation, but more so as an opportunity to kind of increase our efforts. So hosted 3-day training, we did that and continue that. We talked about increasing and promoting and training the event. And we also talked about the increasing of knowledge and gaining an understanding of training curriculum. So one of the things that we found was through this capacity building kind of training, more so kind of a training program, was really looking at, okay, how do you keep this going year round? how do you have a training, have a 3-day training, have a 1-day training, and kind of do these kind of hubs where you get together once a month for 2 hours and present on a certain topic. And somebody within that hub is in charge of presenting for that month. So that people have an invested kind of experience in that. Furthermore, AFC has a boot camp also that we started probably like 5 years ago or 10 years ago. And part of that is a public health boot camp around the intricacies of public health, talking about the discipline of public health, talking about programs, how to do program development and things of that nature, and not necessarily having a science and treatment piece. How do we collaborate with BAI, BTAN Chicago, to make that happen? And so those are questions that are being asked right now. So part of what my response to my problem statement, my project plan, was to create this, and again, I don't have a BTAN chapter that's developed yet. Again, our BTAN chapter is kind of being remodeled and refaced. And so a lot of this I had to come up and think of on my own and not necessarily involve BTAN members because we just don't have one right now. But BTAN Chicago, so part of my idea was to create the Oasis Project. An oasis is somewhere, hot desert, it's hot outside, we're looking for a source of water. As a direct result to it being hot outside, meaning that our workforce kind of knowledge and science knowledge level is not there, that this project becomes a kind of an oasis for that. And so I'm coming to this source to get education, and so that's what I'm kind of thinking of that. Of course, it will mirror 1, 2, 3, 4, the 4 project areas. So in making sure that we have, for instance, let's talk about advocacy real quick. Advocacy and policy. What is that? I have a better understanding now since I work at AFC, since I have now gone through this program. Not necessarily this program, but advocacy is something that's not necessarily talked about, right? So one of the things that I see the Oasis Project is teaching people how to engage in their elected officials. So how do you talk to your alderman? How do you talk to your state rep? How do you talk to your congressman around these issues? And so the Oasis Project will train up people to be able to do that, and they go out into the community and teach people those